So probably what I hear from my patients is the most common trigger for worsening of their atopic dermatitis is change of season. And again, anybody who you hear give a lecture who says that atopic dermatitis gets worse in the winter because it's dry and cold, whatever, doesn't know what they're talking about. Okay, just they're wrong. There's some people with atopic derm who get worse in the summer. There's some who get worse in the winter. Most commonly, though, it's change of season, and this is because we know for certain that your skin can acclimate to different temperatures, to different temperature changes. Temperature is a much bigger driving factor than is humidity, in my opinion. And we know that probably a big part of this is that the stratum corneum lipids, and we know that that stratum corneum lipid bilayer and its integrity is a huge part of atopic dermatitis, right? Obviously, they're more viscous when it's colder, so your stratum corneum gets stiffer, kind of like butter whenever it's in the fridge, versus whenever it's hot outside, those your stratum corneum lipids get less viscous. So think about butter that's been sitting out on the countertop, really easy to put your knife through there. So to me, the biggest change is actually a change in seasons, because their skin has to reacclimate to the new temperature. That seems to me to be the biggest one. Travel also seems like a big trigger, and that's mainly because of the stress. We know that in studies of rats, if you want to stress rats out chronically, you put them in, you restrain them, and you overcrowd them. Huh? What does that sound like? Sounds like an airplane, right? Where you're restrained, stay in your seat, right? The seatbelt sign is on. You're not even allowed to go to the bathroom. And you're overcrowded, right? You got the 300-pounder on this side, the 300-pounder on this side. You're like this, and you can't move for 4 hours, right? That is stressful. And that's a common trigger for atopic dermatitis as well.